Hi there, I'm Allison Johnson. I'm a health educator at Randolph County Public Health, currently working out of the Emergency Operations Center responding to COVID-19. My job changed pretty much in March when things started picking up with the virus here, and we've been working pretty much entirely on COVID-19 related educational materials, connecting people to resources, all that sort of stuff. I'm here with my coworker, Kendall.
Hi there, my name is Kendall Phillips. I'm also one of the health educators here with Randolph County Public Health. As Allison mentioned, we've been doing this work since early March. We actually activated our Emergency Operations Center on March 4th. So we have really been responsible for staying on top of trends, looking at new guidance. We probably look at the CDC's website every single day. So what our purpose here today is to communicate some of the updated ways to travel safely to you all, so that way we can all enjoy a safe summer vacation if we choose to do so. So let's talk. If you're planning a trip, it's really important that you take some extra steps to travel safely. It's summer, everybody wants to take a vacation, and while we still encourage people to stay home as much as possible, we do understand that people kind of have that travel bug. So if we're going to do it, let's just do it as safe as possible. So let's talk about some things to consider. The first thing that we want to consider is, what does spread look like in your destination? Allison's going to tell you more about that.
Yeah, so what does spread look like where you're going? We want to look up ahead of time, do our research, and check case counts, data trends, all of that good stuff in the area that you're traveling to. You can look up your destination, find their county health department website. You should be able to find that information pretty easily. And you really just want to weigh the risks and benefits for that specific area. If they have a high case count, if they have active outbreaks, it's just something to consider and think about how much risk you're putting yourself, your family, whomever you're traveling with in. So then what are the regulations like at your destination? So there can be specific local regulations that differ from county to county, city to city. So you just want to check out the local executive orders and regulations and plan according to what those are. And then we need to think about who we're traveling with or who we're traveling to visit. And you want to know if anybody is at higher risk of serious illness from COVID-19. Generally, our older adults, so 65 and older, or people of any age who have some kind of serious underlying medical condition, are considered at higher risk or potentially at higher risk from severe illness from COVID-19, potential hospitalization and complications. You can check the CDC's website for the most updated high-risk categories or higher risk categories, and just take extra precautions for those folks. So if you are planning to visit someone who is at higher risk, you really need to try and self-quarantine for 14 days before traveling, or if you're traveling with someone who's higher risk, you need to do the same thing if at all possible. That quarantine is just to keep yourself away from any potential exposure so that you're then not exposing someone else who might have a more serious illness if they were to get COVID-19. So if you're quarantining, you need to stay home away from all other people. Don't go out of the house for anything unless it's absolutely necessary. And if you do all of your prevention steps, wash your hands, sanitize, and wear your cloth face covering, maintain social distancing. And then we need to think about who we might be returning to. So we might not travel with everyone from our household. We might have some people at home who aren't traveling with us. So is anybody going to be at home when you return who is at higher risk of COVID-19? And those are those same categories that we talked about before. And we just might need to take extra precautions if we are returning home to potentially care for someone who's higher risk, or if we just live with someone who's higher risk. We really want to avoid all close contact with others, and again, really limit any potential exposure so that we're not then in turn exposing whomever that person is when we return. And then lastly, you need to think about if you've been sick in the last 14 days. So don't travel if you're actively sick. If you've been sick in the last 14 days, or if you've been around someone with COVID-19 or suspected COVID-19 in the past 14 days. Absolutely do not travel with anyone who is currently sick.
Okay, so Allison talked about things to consider. Now let's talk about ways to actually protect yourself and others while you are on your actual trip. So the first thing to consider is washing your hands frequently. So hand washing is one of the easiest, most important steps that we all can do while we're on vacation and even in our day-to-day life, so that way we can help stop the spread. When we're washing our hands, we want to make sure we're washing with clean water and soap for at least 20 seconds. A little fun fact, it doesn't matter if that water is hot or cold as long as it's clean, because the soap is what's doing all the work, as well as that friction whenever you are scrubbing your hands for those 20 seconds. You especially want to wash your hands after you have been in a public place. So whenever we're out and about, if we're going into a grocery store, washing our hands before and after is going to be a really good habit to get into. We also want to wash our hands after touching surfaces that are frequently touched by others. So thinking about other people's cell phones, laptops, if you're sharing counter space, wherever you are, anything that's frequently touched by others. We also want to wash our hands after we blow our nose, cough, or sneeze. As a reminder, this virus is spread through our respiratory droplets, which is that wet stuff that comes out of our nose and our mouth whenever we do any of these things. So whenever we are deliberately releasing some of those, or if we accidentally cough or sneeze, just wash our hands right after that. And then before we have to touch our face, so for example, if you're about to put on your cloth face covering, which we'll talk a little bit more about in a little bit, or if we're about to eat, we want to make sure we're washing our hands before that. If you don't have soap and water available, the next best thing is going to be some hand sanitizer. So it needs to have at least 60% alcohol. The key to using hand sanitizer is rubbing it all over your hands until it fully evaporates. So until your hands are completely dry. So that way it really kills all those germs on your hands. Next, we want to consider avoiding touching our nose, eyes, and mouth. So whenever we have contact with respiratory droplets, the way it comes into our body is through all of these openings. So whenever we are bringing our hands, especially if they're unclean, and we're touching our eyes, nose, face, or mouth, then we're putting ourselves at risk of being exposed directly to the virus. It's really hard. It's kind of the million-dollar thing, right? We don't think about how often we touch our face until we're told not to, but it is really an easy way for us to help prevent some of that risk of exposure. Next, we want to avoid close contact with others. And the way we're going to do this is by keeping 6 feet of distance from ourselves and others at all times. You've probably heard by now the term physical distancing or social distancing. And the reason why this is so effective and why this works is because those respiratory droplets kind of travel some distance, right? So whenever they're released from our mouth, they're going to land on other things, but those respiratory droplets are actually pretty heavy. So whenever we keep a physical space from ourselves and others, we give that space for those respiratory droplets to land on the ground instead of on other people. Next, we want to wear a cloth face covering whenever we're out in public. And the reason why this works so well too is we're holding those respiratory droplets in. So we're essentially protecting other people from ourselves. This is especially important if we end up being an asymptomatic carrier. What that means is if a person has the virus and is contagious but does not have any symptoms, they are what we call an asymptomatic carrier. So you could be spreading the virus without actually knowing you're spreading. We're still learning a lot about what it means to be an asymptomatic carrier. We think it could be anywhere as low as 6% of the population all the way up to 40% of the population. We're still kind of understanding how many people can spread while asymptomatic, while not having any symptoms. So in the meantime, even if you feel perfectly fine, even if you don't know anybody that has been sick recently, it's still really good practice to wear a cloth face covering at all times whenever we're out in public and interacting with others. The next thing we can all do that's super simple is covering our cough and sneeze. So sneezing into our sleeve, sneezing into our shirt, or coughing, either way, coughing into a tissue. all of that is going to do the same thing that that mask is going to do, and that's keeping those respiratory droplets in to avoid them from landing on others. Another way you can help protect yourself and others is picking up food at drive-thrus, curbsides, restaurants, or stores. So making sure that we're avoiding those crowds again when possible. So avoid eating out at a restaurant whenever you can. That's going to be the riskiest choice out of everything that you see here. But if you absolutely want to or need to, for whatever reason, sit down at a restaurant, you can call ahead and ask some of these questions. So what precautions are they taking? What prevention measures are they taking? Are they screening their employees? Also ask ahead of time about the distance between their tables. So are they keeping 6 feet apart from their tables? And are they doing it around all sides? So I've seen some restaurants that might have 6 feet between, every other booth, but they might be sat next directly to another table. We also want to ensure that all staff and servers are wearing a face covering. So right now in North Carolina, for example, it is law. It is the most recent executive order that was passed that all servers and staff have to wear cloth face coverings. That's not the case in every state. So if you do travel out of state especially, that would be a really important question to ask. And whenever it is possible, we would really encourage you to choose to dine outdoors instead of indoors. That's going to greatly reduce a lot of that risk.
Okay, so now considering how you're traveling, what's going to be your mode of transportation? Because that can also affect how we're exposed and what our risk level is. So risk in general, there's not really a no risk situation for COVID-19 unless you are completely isolated from absolutely everybody at all times. And that's not really practical for most people, right? So we have to think about risk on a spectrum from low risk to high risk. So some of these things are going to be lower risk, some of these things are going to be more moderate, and some are going to be higher in risk. So if you're considering air travel, that's going to be one of your riskiest modes of transportation, in part because you're coming in contact with multiple different environments at an airport, and you're standing in different lines, security lines, you're waiting in different terminals. There are a fair amount of other people around. So the opportunity for coming in close contact with others is escalated, and there are just more surfaces that other folks are coming in contact with regularly. So the potential for touching a surface that somebody else has touched without it being disinfected is higher. Social distancing might be difficult if flights are full. Airlines are taking certain precautions right now. They have, lower thresholds for how many folks are allowed on a flight at a time, but those things also depend upon how well they're enforced. So a policy is only as effective as it's enforced. So if folks aren't spaced properly on the flight, then you could be at an increased risk if you're not spaced 6 feet apart from them. And then you also have to think about the fact that you're in a closed environment. So that's the same air that gets recirculated for the duration of your flight. And the likelihood of you being on a flight for 10 minutes or less is extremely low. Usually takes longer than that for it to take off. So just considering that air travel is going to be your highest risk in terms of travel mode. A bus or train, there's still going to be some risk here for exposure. There are generally a fair amount of people on buses and trains. They can be in close proximity to one another if some sort of physical social distancing isn't enforced on there. And then again, it can be a longer bus or train ride depending on where you're going, how far you're going. Folks are getting off and on. So again, that close contact is a potential risk. If you're traveling by car, if you are traveling with people from the same household, then your risk level is going to be a bit lower, because you wouldn't be coming into contact with new people that you haven't been exposed to already. It's going to be a little bit different if you're traveling by car with folks that you don't live with, because that's going to be introducing you to whatever they have been exposed to that you haven't already. In addition to that, you have to think about the stops that you make along the way for gas, food, bathroom breaks. That could expose you to other people potential for close contact depending on how long and how close to folks you are in those locations. And again, with the frequently touched surfaces or objects, just keeping those things in mind. If you travel by RV or camper, again, there's going to be some risk for exposure, and it depends on how you go about it. So if you're staying at an RV park, if there's a public restroom, public water areas, those are things to consider. If you're coming again in contact with other folks or with surfaces that other people touch before they're disinfected, think about those things. And again, you are probably stopping for gas and supplies, and you have to think about all of those things that you come in contact with along the way. We also want to anticipate all of our needs while we're traveling and for the entire duration of our trip. So make sure you bring a cloth face covering for each person who's traveling from your household. There are certain exceptions in North Carolina for folks who are not required to wear cloth face coverings. As we all know, right now it is required in public places that we all wear a cloth face covering. Unless you are 2 years old or younger, it's not safe for them to wear one because they wouldn't be able to safely put it on and remove it by themselves without assistance. And then there are certain medical conditions that make it unsafe for people to wear them. In other states, that's not necessarily the case. They might not have a requirement. So just keeping that in mind, we strongly encourage you to wear one no matter where you go, but you might encounter people who aren't required to wear them. And so keep that in mind as well and really maintain a broader social distance in those cases. Make sure you bring enough of medication for your household to last for the whole trip so that you're not having to hunt down whatever those needs might be. Make sure you bring enough alcohol-based hand sanitizer to last you for your whole trip. And think about all the times that you might have to sanitize. So every time you make a stop, every time you put your cloth face covering on, all of those things. So make sure you pack plenty and that it's at least 60% alcohol. Make sure you bring food and water, have plenty of snacks, again, to reduce stops to just the bare minimum so that you reduce the people and surfaces that you might come in contact with. And then bring some EPA certified disinfectants. You can log on to the EPA's website and find a really thorough list of all of their certified and approved disinfectants against COVID-19, and make sure you have that with you so that you can wipe down surfaces and ensure that you're keeping yourself and your travel mates safe. And then call ahead wherever you're staying to check about what their safety precautions are for that facility. So make sure that they're doing what they should be doing to help keep you and your family or whomever you're traveling with safe.
You heard me talk earlier about the importance of maintaining a social distance from others. So let's dive a little bit deeper into that. Just to reiterate, what we mean by maintaining a social distance from others is keeping 6 feet apart from all others who do not live inside your household. And this is going to limit potential exposure. I want to elaborate on this just for a minute here because we have this assumption, and we're seeing this happen a lot both here in the county and really all over the nation, that just because you are related to someone or just because you're family, that's going to somehow minimize some of that risk. And it's not. We're now seeing lots of cases, again, across the country and here in the county where people are having cookouts or birthday parties or just any other kind of family gathering. But because they're gathering with people who live outside of their house, they're spreading it to the whole family, essentially. So it's really important that even if we are visiting family or visiting people that we know, that we're still keeping that 6 feet away if they do not live inside of our house. If it's not possible to maintain a social distance, ask yourself the following questions to help understand your risk of exposure. So you'll see here kind of a grocery list of different symptoms and signs of COVID-19. You'll see fever, chills, coughing, so on and so forth. I won't read all of them. And it's really important that you do ask yourself if you've had any of these symptoms. COVID-19 illness really looks like a whole spectrum. You have some people who don't have any symptoms at all, or they're very, very mild. Maybe they just have a couple of sniffles, to people that end up needing to be hospitalized. The reason why we're looking at the last 14 days is because the incubation period of this virus, which means the time a person is exposed to the virus from somebody else to the time they become ill themselves, can be anywhere from 2 to 14 days. So again, it's really important that we take all of these into consideration, even those that don't seem traditional to COVID-19, For instance, even if you just feel a little dizzy and have a backache, it's really important to treat that just as seriously as anything else and to not dismiss it as the flu, allergies, or anything. You also want to find out, have you come in close contact to somebody who has tested positive or is presumed to be positive? So even if they have no symptoms at all, again, if they know that they have been positive in the last 14 days, if you've come in contact with them, you really want to minimize your exposure there as well. And if they do say yes to any of these questions, then you may be exposed, and we want you to limit your contact with others as much as possible. So if you do choose to travel, there's just a few things that we want you guys to keep in mind. Remember that this is not a normal summer. So we're not going to have that normal summer vacation that we all might be used to. I'll give a personal example real quick. I was planning on going to Texas originally this summer to visit some family, and I actually would have gone at the end of June. Well, I ended up deciding not to because air travel was really risky, and I kind of knew that things were starting to escalate in terms of case count. Well, now recently, both North Carolina and Texas have had their highest daily case counts to date. So it was really important for me to make that decision because I would have put myself at great risk otherwise. We also want you to consider all of the potential risks associated with your travel, both for yourself and others. So like Allison was talking about earlier, asking yourself, who are you traveling to? And then who will you be coming back to? Do you work in a high-risk setting, such as a long-term care facility or any other congregate living setting? Do you interact with the public? How many people would you potentially be putting at risk? And can you afford to take that time off? Can you afford to take 2 weeks off to recover? Can you afford to potentially get sick? So you have a lot of really important questions to ask yourself both before and whenever you would be coming back. And then making informed decisions can really help slow the spread. So we've given you a lot of information here. We're going to give you plenty of other resources for you guys to be thinking about, so that way you can make the best possible decision for yourself, for your family, and for your community.
So if you have any questions or concerns, strong feelings about any of these things that we talked about today, you can give us a call at the Randolph County Coronavirus Hotline. You see the number right here on the screen, and those are our hours of operation. We're here all through the week, Monday through Friday, 8 to 5. You can ask for Kendall or myself personally. We're usually here. If we're not here, if we're not available, all of our folks who answer the hotline can answer your basic questions. But if you have something that's kind of beyond their scope and more health education focused, then they can certainly take a message, and we'd be happy to get back with you. You can also email us at healthed@randolphcountync.gov. You will reach Kendall, myself, and our supervisor, Wendy Kinnan, through that email address. And then check out our website, Randolph County Public Health. We have a COVID-19 specific website. We've got this really great interactive data dashboard that we update every Friday with our data trends local here to Randolph County. So there's a lot of good demographic information. It shows our trends and all of that sort of stuff. And then not included on here, but please follow us, like us on Facebook. We update daily with our daily count, all of our numbers, and then we share information as we get it to county specific, statewide, just things to be aware of, fun facts, education, all that kind of stuff.
You may have seen this already, but North Carolina has put out what's called the 3 W's campaign. Hopefully you have seen this by now, but if not, these are just a few simple things to keep in mind that you can do to help protect yourself and others, both while you travel and just in your day-to-day activities as well. Wear a cloth face covering, even if you feel well. It can help really stop some of that asymptomatic spread. Waiting 6 feet apart from others and avoiding close contact, and then washing your hands or using hand sanitizer. Washing your hands frequently and often, and then avoiding touching your face. So these 3 W's, wear, wait, wash, we're really going to help keep yourself and your family safe.
So then lastly, here's just a nice little bullet pointed list of most of the things that we covered, our highlights, if you will, just ways to make sure that you're vacationing as safely as possible. We want you to be able to enjoy your vacation, so let's do it safely, as safely as possible. I won't read all of these bullets for you, but just again, keep in mind who all we're affecting and take all of those precautions, not only for yourself, but for other people. I also want to note that on our website, we have a resources page that has a bunch of flyers, signage, infographics, all sorts of stuff. This will be available on our webpage and other avenues throughout the county. Also information on proper putting on and taking off of face coverings, how to wash your hands, all those sorts of preventative measures. What does it mean to socially distance? What's self-monitoring? What's quarantining versus isolation? We've got lots of helpful information on there to share with your family, friends, brush up on it yourself. So thank you guys for tuning in. Please feel free to reach out to us if you have any questions or concerns.